Serotonin dopamine antagonist. Patient will respond favorably to antidepressant 20 to 40% and experience a partial or poor response to monotherapy. So these SDAs, serotonin and dopamine antagonist or atypical antipsychotics, they are also occasionally used as an adjunct therapy. They will be used as an adjunct therapy, not monotherapy. So aripiprazole, brexpiprazole, quetiapine, and the combination of fluoxetine and olanzapine are approved as adjunct therapy in depressive disorder, major depressive disorder. Now, treatment of mania and bipolar. This is increased and also increase in number of available medications for the treatment of mania. Next is lithium. Lithium salts are used acutely and prophylactically for managing bipolar patients. Lithium is effective in treatment of patients exhibiting mania and hypomania. Many cellular processes are altered by treatment, but the mode of action is unknown. The therapeutic index is extremely low. It is very toxic, and common adverse effects are headache, dry mouth, polydyspia, polyuria, polyphagia, GI distress, hand tremor, dizziness, fatigue, dermatologic reactions, and sedation. Adverse effects are due to higher plasma levels, and they will indicate toxicity and include ataxia, slurred speech, coarse tremors, confusion, convulsions. Thyroid function is also decreased, and it also should be monitored. Lithium is renally eliminated, and it should be used cautious when you have to use in patients who are renally impaired. You have to do dosing adjustments, and it is best choice with patients with hepatic impairment because it is not eliminated through hepatic metabolism. Now, other drugs, several other anti-epileptic drugs such as carbamazepine, valproic acid, lamotrigine. They are also approved for mood stabilizers for bipolar disorder. Other agents may improve manic symptoms include older chlorpromazine and haloperidol and newer antipsychotics. The atypical drugs risperidone, olanzapine, ziprasidone, aripiprazole, escitalopram, cariprazine, and quetiapine. They are also used for management of mania. Now, quetiapine, lurasidone, and the combination of olanzapine and fluoxetine, they have been approved for bipolar depression. And here we go for the next topic.